This is Donna Taggert, the Department of Aging Human Services dietitian. Today, I'm going to be talking about the High Blood Pressure Awareness Month. High blood pressure affects more than 1 billion people. That's a lot. It is technically called hypertension, which is the definition is force of blood against the artery wall that's consistently too high. Normal blood pressure, around 120/80. Then there's stages, stage 1, stage 2, and then the elevated severe is greater than 180/120. Sadly, it's very silent. It can be doing all kinds of damage and you don't even know until you start having problems with the organs that it's starting to damage, like our kidneys, our heart. So it's important to always get it checked at your doctors, and maybe check it at home too if you're one of those people that have the white coat syndrome where you always have high blood pressure when you're at the doctor. But it's important to keep it monitored as we get older. That's one of the risk factors. Men tend to get high blood pressure a little bit earlier than women. If you have Asian, Hispanic, Black background, higher risk for blood pressure. Now, family history. Nothing we can do about all those things, but the ones that can cause high blood pressure we can modify. Not always easy though. Obesity, that's a hard one. Lack of physical activity, sometimes hard for people to get more active. Increased sodium intake. If you retire and all of a sudden you're eating out a lot, you're buying convenience foods, lots of sodium in that. Excessive alcohol is a risk factor. Stress, another risk factor. So what can we do about it? Well, back in the 90s, and it seems like a long time ago, but back in 1990, they did a lot of research and they were finding people that followed a plant-based diet tended to have a lot lower blood pressure than people who did not. So after about 6 years, they developed a diet and they presented it at the American Heart Association's meeting back in 1996. It was called the DASH diet. It has nothing to do with Mrs. Dash, all those seasonings, but it stands for dietary approaches to stop hypertension. And they found that not only the potential benefits of lowering blood pressure, it certainly did lower blood pressure, it also was lowering people's weight, lowering the risk for cancers, lowering risk for type 2 diabetes, heart disease, lots of other benefits from this diet. And basically, it's a plant-based diet, lots of fruits and vegetables, nuts, seeds, legumes. They do allow meat, but it's, a smaller portion. And they limit saturated trans fats, they limit alcohol, they limit sodium, and they limit fatty processed meats and added sugar, which is especially in the sugar-sweetened beverages. So let me tell you a little bit about the DASH diet. It has been endorsed by the American Heart Association and the Mayo Clinic. It has earned top billing for many years on the U.S. News and World Report that puts out every year their top diets, and they rate them and all. Now, it's been duking it out with the Mediterranean diet. Past 8 years, Mediterranean diet's been #1, but #2, not a bad place to be. It does rate as, and they do best overall diet, then they have categories. So in the categories, it's come up as #1 in best heart health diet, best diet for high blood pressure, and then #2 spot is best diet for high cholesterol, best diet for pre-diabetes, best diet for healthy eating, and best diet for gut health. So they ain't bad for, a diet with all, I think they study about 50 to 100 diets that are out there, and there's tons of diets out there. So Mediterranean diet, DASH diet, pretty good as top overall. So one thing they do limit is the sodium. What's recommended is about 2,300 milligrams. They go a little bit lower, 1,500 milligrams. Average American, 2-3 times that amount of sodium. Shaking the salt shaker, not much salt comes from that. And salt is sodium chloride. So it's 60% sodium, 40% chloride. That salt shaker adds a little bit, but the bulk, 90% of our sodium is coming from foods, processed foods, restaurant foods, fast foods, that kind of stuff. So it's really important to read those labels. So you look down the side of the label and it says sodium. And if it's 140 or less, that's considered a low sodium food. If it's high, and say you're the food says 1,000 milligrams, trust me, there's foods out there even higher than that, and you're trying to stay to 1,500 milligrams a day, that might not be a food you want to choose. But again, it's in the context of what you're eating for the day. Say you pick a microwave meal. It's going to be your dinner. That's all you're going to eat. And it's 600 milligrams. Well, good luck if you find one that's 600 milligrams. Most of the microwave meals are much higher, but you can find them. They're out there. So that's not bad. That's your whole meal. But if that same food was 600 milligrams and was just a snack that you're going to be eating during the day on top of everything else, again, you might want to think about it. So you got to use, think about it. How is this fitting in my day? Am I eating out later on? Maybe I need to be careful the other meals and stuff like that. Read labels, very important. And the more you can do that, it's a whole natural food like fruits and vegetables in their natural state. You can do frozen vegetables because all they've done is flash frozen them. Canned vegetables, you have to be careful, again, reading the labels. Compare manufacturers. For instance, potato chips. There can be potato chips that have very little sodium in it. They're still regular potato chips, or there can be ones that are really high. So again, choosing wisely amongst the foods that you read the labels on. There will be a link of some things about the DASH diet. This one is going to be from the Kidney Dietitian. It's an excellent resource. That's why I wanted to include it. It has all the foods that are on the DASH diet. So your fruits, your vegetables, your grains, your whole grains, your low-fat dairy, poultry, nuts, seeds, legumes, your fats. They're all listed, how much you should target for the day, what's the serving size, and where you can find it. And then the flip side, the second page will be like a week's worth of diet using these type of foods incorporated into that. So it's a really good resource. The other one I want to include is from the dashdiet.org, and I'll tell you the different websites to go, but this is where they originated the DASH diet. They have lots and lots of good resources. This you can copy the link, print it out. I recommend having more than one because you want to monitor this. This is for a week. And it lists all the foods. What is your target? For instance, vegetables. It tells you what the portion size is. Half a cup cooked vegetables, a cup of greens type thing, half a cup vegetable juice. Target, least, and it says at least 4 to 5 servings. So there's a little blocks there. And as you go through the day, whatever you're eating, I see a vegetable, click. Oh, I had a glass of milk, click. Oh, I had some legumes, click. So you go through and you click off what you've done, and hopefully by the end of the week, you're going to see either you're doing great or you're like, ooh, I'm not doing so good in some areas. I'm a dietitian, and I think, oh, I know what I should eat. And I did this, and I found myself falling short in the fruits and vegetables. In my mind, I was thinking, I'm going to eat this, and did I do it? I'd forget. But this, hanging on your refrigerator, before you open it, you're like, oh, let's see, I am not had any fruit today. Let me do a fruit. It's a great, great tool, and it really helps you focus on the things you should be eating. Also, Amazon, I got a couple books. You can go to the library and get some DASH cookbooks. These two are going to be handed out as door prizes if you come out to the senior centers when I'm doing this talk. This one is called the Practical DASH Cookbook for Seniors for Two. It's color recipes, great print font, so you don't have to get your reading glasses out perhaps, and menu planning in it. And this one's called Super Simple DASH Diet Solution for Seniors. That's a mouthful. Eat well, feel better, and lower blood pressure. That's the title. Again, look at these recipes, nice big colored. I like to see color, what it's supposed to look like, and a lot of good information. I mean, look at this. It's great. So there's lots and lots of options to get started, trying to get started on the DASH diet. So come see me if you need extra help with that. So there are some supplements out there. People are always asking me. My general recommendation is try not to do supplements if you can't do the foods, then okay. But try to get the nutrients bound in the food itself. It's so much better. It works better together. A lot of the studies and supplements for high blood pressure are a very low quality study, very small sample size for who they're studying. So hard to make recommendations, but there are a few out there. Aged garlic extract supposedly can help your vessels relax so the blood can go through without pounding. Berberine, some studies are potentially showing that could be helpful, but I caution you, if you're going to do a supplement, make sure it's a reputable dealer. Make sure they have a third-party testing so they have confirmed that it's what it says it is. It confirms that there's no heavy toxic metals in it or something like that. You always have to be careful because it's not regulated. Supplements are not regulated by the FDA. And always run it by your doctor. Sometimes you're on medications that will be affected by those supplements. You don't want to screw up some other medication, so always do that. There's a few other things. Beetroot juice. I brought them out to the centers one time. We all tested beetroot juice. Either you liked it or you didn't. It was something you might have to get used to, but it does seem to help with blood pressure. Beets have something in it called nitric oxide. It relaxes those blood vessels. So even if you just slice up beets on your salad or something, that's going to be a helpful thing. Beetroot juice is very expensive. So again, you have to decide if it's truly worth it or not. Short term, it does seem to show some benefits. Dark chocolate. Who doesn't like some chocolate? It should be dark chocolate. It has the most of the flavonoids that help lower blood pressure. Again, you have to be careful. A lot of the dark chocolates are being found to have lead, cadmium in it, so you want to be careful that you don't overdo dark chocolate, but little dessert, it's a good thing to help. You want to avoid alcohol to keep the blood pressure under control. Caffeine. A lot of people are afraid of caffeine. It does briefly raise your blood sugar, but they have blood pressure. But overall, a person who follows a heart-healthy diet usually can have coffee and tea because it really is linked to lowering risks. So you have to be careful. Just don't do too much of it is what I recommend. NSAIDs, like ibuprofen, again, use it judiciously. If you're in pain, okay, but don't just pop them all the time because that can affect your blood pressure. And you see a lot of times cold medications. You want to make sure you get the ones that are specifically for people who have high blood pressure. Sometimes lifestyle changes just aren't enough. You might have to go on medication, so talk with your doctor about that. There's no single food that's going to be magically like, I'll just drink my hibiscus tea and I'll have the best blood pressure in the world. No, it's really the dietary pattern. I say this all the time, but that DASH diet has been shown through research studies has lowered people's blood pressure significantly, so it's worth at least trying. And then, like I said, the website you can go on, there's one at the NIH that will give you a whole week's worth of DASH diets. We'll have that posted as a link. You can go on the Heart Association. They have a lot, www.heart.org. And then the best is the DASHdiet.org. Everything you want to know about the DASH diet is on there. And I think we're going to be hearing about the DASH diet a little bit more because next month I'm going to be talking about gut health. And guess what? Number 2 best diet for gut health was the DASH diet. So we'll again be addressing it again. So you can get a little head start, get started trying the DASH diet, and then we'll talk about it again next month with gut health. Okay, I'll see you back here next month. Bye now.